Good afternoon, everyone. I am Dr. Rashi Agarwal and I am going to be speaking on gambling disorder. So, just the overview first of all. Gambling history is as old as time. We might think in today's time that gambling is something new. It is happening these days, or specifically things related to online gambling. But we all know that it has started and it is quoted in literature since the time of Mahabharata also. So initially there used to be satta, these cock fights which used to be done in a ring, or also penny betting. Various small animals, bigger animals were always used in all kinds of civilizations. With time, with progress, with technology, the disorder remains the same. It is just changing its forms. We are going to be looking at a very overview of a clinical and therapeutic review. Okay, first of all, initially we thought of it as an impulse control disorder. Like Dr. Madhur explained, the anticipation is more than the reward. So in gambling, people were always like, okay, I am going, something is going to happen. Specifically, it is said that we all know about Las Vegas. It is currently like the biggest place where one goes to gamble and it is legal there. Considering the Indian scenario over here, where gambling as such is forbidden by law on land and also now online. So we are clear with that. Initially, we thought that it is impulse control. Like we want to do it, but we are unable to control it. But it has recently been shifted to substance related and addictive disorders, and we just discussed the neurobiology. Coming to the patient profile, like we say with every disorder, it is available to all of us. Why only some of us are going into like a disorder and some of us just do betting here and there, or even I would like to say even very small mobile games which ask you for a very small amount of money like 5 rupee or 10 rupee. A lot of people might do it off and on, but we do not indulge in that behavior for a very long time because we do not have that personality. The specific cognitive distortions are not there. The detection gap, again, this is not something which probably people would come to us in a mild or moderate situation. With practicing clinical psychiatrists like us, people would only come to us when it is a severe disorder. They have either gambled away everything, which is when they come to us. With males, like they have gambled their home away and all their wives' jewelry and everything else, and now they are in debt. Or with women, the end consequence is either repaying after selling out everything to going into prostitution. There are reports which say that in this endless loop, it destroys the whole families and the anticipation of recovering the loss. So we are just trapped in that I want to recover this and we keep on betting more and more and more. There is as such the basic treatment remains CBT still. Now why we are redefining the diagnosis? Because first of all, if we don't know that why we are doing this, what is happening in the brain, unless we define the diagnosis, it is difficult for us to come to actual conclusion and the result. So substance related, like any other addiction disorder, it has tolerance, like increasing gambling with more amount of money and achieving the desired excitement. What happens is that if you download any kind of game online, you will initially be like, okay, these are 10, 100 free coins and you can use it to play. Everybody likes doing that. Very small mobile games, I would say. Even the runner games also. And then you are trapped in that loop because you're like, what is 10 more coins? What is 10 more coins? Okay, I can spend 10 rupees. I can spend 20 rupees. And this is how it keeps on increasing and increasing. This is tolerance. Then withdrawal. If you're not doing that, either your brain is thinking about it or you are losing sleep on that. Loss of control. Why? I cannot cut back. This is what patients come and tell us. I want to. That's why simple conversation, which regular people call counseling, does not work. Because they will say, आपको पता नहीं है कि ये गलत है, आप क्यों नहीं रुकते? They know it. It's not like they don't. They know, they try to cut back, but their impulse, their loss of control is so high that they're unable to do that. Functional impairment, they're like relationship loss, job loss, educational opportunities loss is high. The shift has now also made us understand better that there are going to be biological markers which are specifically involved. And also I would like to point here personality issues, which is harm avoidance, which some studies say is high in people who do gambling and who properly go into pathological gambling. and some studies report that it is also less. As with other non-substance addiction, substance addictions is high in people who go into pathological gambling, which is overall, I think the symposium just before us discussed nicotine dependence and the society's view about it. Very high nicotine dependence, and as per my clinical experience, I would say one of the most difficult one to leave also because of the widespread social prevalence of it. Any other substance disorder, and obviously undiagnosed mood and anxiety disorder, antisocial personality disorder, we see very high clinically when we try to evaluate and go through personality testing, and also alcohol use disorders. Also, there could be one reason why they all are working together. Why? They're served together. If one needs to go and work at a place where they're gambling, like again, I would use the example of Vegas. You're sitting there, you have availability of substances also. It is served in that atmosphere. So your brain starts linking up both of them. So even if you started any one of them, your brain automatically starts asking for the other cue to involve both of it. Even in Diwali parties, I'm not even talking about Vegas, even in here, culturally there was no association of having card parties along with Diwali, especially in northern India here. But now it is a thing. There will be substances, alcohol and everything being served in the name of Diwali party, and also card gambling is happening, casinos, which is again, we all know is illegal on land here. Now, what is the dose response like? Is the longer treatment always going to be better? So, some meta-analysis have found no significant differences in outcomes, either with brief interventions or also for multi-sessions. But yes, if we think clinically, I would say multi-session would be better in the sense that we can have the patient come back again and again, and we can have intervention regularly so that they don't keep falling into the loop of gambling. Dr. Madhur already discussed the neurocognitive deficits and the Stroop test. I discussed this study. So the basic therapeutic intervention will start with the psychoanalytic of why they are going into that. Gamblers Anonymous, difficult especially in our area for people to come together and do that. What I would say works in our area would be behavioral treatment, cognitive behavior therapy, brief motivation therapy, and or pharmacotherapies. CBT, easily available. I would say we all have access to clinical psychologists in most of the area. Starts with cognitive restructuring, motivation components, and also specifically helps with relapse prevention. I'll quickly come to pharmacotherapy and why and how it's happening. There's no drug specifically which is working on pathological gambling. But yes, we are saying and talking about undiagnosed mood disorders and anxiety disorders. So SSRIs always help. If nothing, then at least controlling the anxiety, or even somewhere reducing the anticipation to start and do that. Mood stabilizer lithium works good with impulsivity, as it was previously classified as an impulse disorder, and glutamatergic agents like topiramate and N-acetylcysteine. Naltrexone we off-labelly are using everywhere, just besides its opioid antagonist action. So yes, here also it is blocking the high or the pleasurable reinforcement. Very strong evidences are using it in a lot of randomized controlled trials. So yeah, naltrexone helps. Again, the barriers, patient personality, very high novelty seeking behavior. So the intervention should also be based on either the personality management, modification or intervention, or either distraction or shifting them, or they can find novelty seeking elsewhere rather than into a pathological gambling. Total abstinence is possible, or what controlled or less harm reduction we can do. Treatment seeking, with any disorder, we all know that, okay, we are not working on alcohol disorder, we are not working opioid disorder. We need the undiagnosed mood disorder first to work on any kind of addiction. Again, I would just recommend, this is a holistic assessment and treatment. It cannot be done in very short clinical interviews. This needs rigorous work, especially in working with a clinical psychologist also. Thank you so much. I'll have Dr. Pankuri take over instead.
By the time they adjust the slides, I'll introduce. I'm Dr. Pankuri Monga. I'm currently working in Jodhpur as a consultant psychiatrist and assistant professor.